Well, getting students back into class in the middle of a pandemic, of course, has been a major and ongoing concern for families all across the country for months now. And tonight, a group of doctors says the CDC misinterpreted its research on opening schools. In fact, they say they believe the decision to keep schools closed or even partially closed is doing more harm than good. Joining me now is one of those doctors, Dr. Monica Gandhi, an associate professor at the University of California, San Francisco. Thank you so much for being with us. We appreciate your time.
Thank you.
My general understanding of the guidelines released by the CDC a few weeks ago was that basically they came out and said that it is safe to reopen schools as long as the standard mitigation efforts that we've all heard now for months are in place. The washing of the hands, the distancing and the cleaning, ventilation, hand washing, contact tracing. So it was not an exact blueprint for schools. I know there was frustration out there among school leaders, but what is your issue in terms of what you're calling a misinterpretation of the work that you did on the same topic?
You know, there were two things in the CDC guidelines that were concerning and also made it difficult for places. In fact, some places that were going to open didn't after they issued them. One was that the community transmission had to be low prior to opening schools. And the second was a quite strict adherence to a specific distancing number of feet, which was 6 feet. So, you know, one thing that they cited was an MMWR article that was written. The senior author is on this editorial we wrote, Dr. Tracy Herg. And it was 17 districts in Wisconsin, and the schools opened even when the prevalence was very high, up to 41.2% in some cases of community transmission. And there was still incredible safety if you used masked, certain amount of distancing. It wasn't 6 feet. It was actually generally about 3 feet, 3 to 6 feet. And then ventilation, but the ventilation didn't need to be anything fancy. They often opened the windows. Or in fact, most of them, only half, less than half even installed ventilation systems. So I think the concern was they were putting stringent guidelines into play that didn't actually reflect what was published in their very journal that they were citing in terms of school safety.
So then, obviously, the CDC report set up those color zones. Blue, yellow, orange, and red. Orange and red are the high transmission areas. If I'm hearing you correctly, you're saying that even in areas deemed orange or red, even if there is high transmission in that community, you can still safely reopen schools. Fair?
Yeah, you know, yes. It's kind of like hospitals where we just, in the places that you do the right thing, which are masking, distancing, and ventilation, and they're not hard rules around those. They're kind of general guidelines, and that was what the article showed us. There's safety in that setting. It's actually people get community transmission, but not within the schools. And that Wisconsin study showed 7 children got it, you know, in the entire period of study to COVID-19, 2 months, and they didn't get it from school, and 0 staff got it. So that was really helpful to know that.
And listen, I have one son. He's still very small, so I haven't had this debate in my home yet. But I would imagine if he were school age, as a parent, just as a human perspective, my mindset would be, I don't want to take the risk. I know kids aren't largely impacted by it, and if so, it's typically very mild. But as a parent, for a second, you don't necessarily want to. Some folks don't want to take the risk, even if it is a small risk.
You know, I think what we also put in this editorial is the effects of not having in-person learning. And this has been documented actually since April by the American Academy of Pediatrics, but I think it's sometimes doesn't get the headlines as much, how much depression, anxiety, learning setbacks, obesity, even the development of diabetes. There is a lot going on with kids who have been out of school for this long. And to give that statistic, you're right that children are not at significant risk for poor outcomes from COVID. As of March 3rd, 286 children died in this country over the year from COVID, and every child death is a tragedy, but that is the same as influenza, which we have decided to take a risk as society because learning is so important. And then MIS-C syndrome is very rare and treatable. So it is figuring out the risk versus benefit analysis. And if it was all fine at home, there wouldn't be a push for this in-person learning, but it hasn't been.
And it's a really tough issue. And obviously, we're all better off as families and a society with kids in school, in person, back to a routine. It has been brutal on so many families out there. But one last question. Obviously, the kids are not the only ones in the school. There are teachers and support staff and cafeteria workers and custodians, and they're concerned about their health as well. They're obviously older. They may have underlying conditions. And my understanding is that the White House has made getting teachers vaccinated a priority, trying to really ramp up that effort this month. But have also said that's not a prerequisite to reopening schools either. A priority, but not a requirement.
Yes, but with the vaccines being here and with teachers needing to be safe, I personally and the other authors on this paper support teacher vaccination before going back. It was safe, with these mitigation procedures before, but it is great. Of course, people should feel safe, and the vaccines are here. And so in terms of who to give it to, opening our schools is such a huge priority. But the issue is then, even after teachers are vaccinated, we do have to think of the rules. We do have to think of the requirements in schools. If everyone's vaccinated and all these safety mitigation procedures, at that point, we really have to open.
Just one bit, an important bit of the massive reopening debate this country is now in.
Yeah.
Doctor, thank you so much for your time and for your expertise. We appreciate it.
Thank you.